So if in fact stem cells can help diabetes,
Kidney failure people on dialysis, this should be something that's absolutely done, at least to try and see what it'll do for them.
so it could be a process that doctors go through kind of on a checklist.
Right. As we go through people's medical histories, because we always take a very detailed medical history if they're coming in, even if it is just for a knee, and see what other kinds of conditions they might be having, and then monitor it and see what they do. So that's why we're studying all these different conditions, is because we want to know, is stem cells effective for things? And we've found things that it's extremely effective for, and we've found some things that it's really not effective for.
And it's interesting that you talk about some of these companies that sell stem cells from youthful tissue.
Mm-hmm.
They probably are out there trying to push stem cells for everything, whereas in your case,
Yeah.
your feeling is that there's so many things that stem cells are great at, we don't need to ever use stem cells for something that doesn't work.
Right. Because this is such a burgeoning field that there's a market there. Okay, where you've got a market, you're gonna find companies that want to fill that void with their product, and so that's what we're seeing today across the country are what the FDA would call bad actors. Okay, these are groups who are proclaiming to provide stem cell therapy. Patients are paying $6,000 to $7,000 for a shot, only to find out that there were never any stem cells in that concoction. Now, I don't want to say that they're completely horrible, right? These products that are coming off the shelf that they're calling stem cell therapy in a product where they just order it from a bio company, they get it in a little 1 or 2 or 5 cc vial. It does have growth factors. It does have some cytokines and other things that can help stimulate growth and improvement. But to say that it's a stem cell treatment and that you're going to get the bits of stem cells and the exosomes and the things that they produce and how they create that environment to heal and repair, that's just not founded. It's inaccurate.
So some people in the past, and I have a very good friend who's got MS, and he went overseas to get treatment.
Sure. Mm-hmm.
What was the protocol there? What type of treatments do you imagine he was getting?
Again, because it's so new, probably the ones that were on the map first were out of the country. So that's why you see a lot of our football athletes,
Going to
a lot
Europe,
of them
yeah.
still going to Europe, because they've created these alliances and they've got a rapport and they have this reputation. So it's just, for their medical staff, it just makes sense to keep working with these groups because they've had good outcomes, so why not? Well, why not is because now we do it here at home. You don't have to go outside the country. We can do it.
You don't
right
have
here.
to have frequent flyer mileage to get that
You just
shot.
don't have to do that. And so they're discovering that, and more we've got people coming from all over the world, really.
What are the age restrictions? What age should someone be old enough to qualify, and is there a limit as to?
Yeah, and that's a great question too, because we hear that a lot. Oftentimes we'll get folks in their 70s, even their 80s, concerned that their cells are too old, that they're just not going to produce. And that's unfounded. Actually, we are finding them, again, if you take it from the fat tissue, the stem cells in the fat tissue seem to still retain a very youthful ability to regenerate and to repair, even in somebody in their 80s. Now, beyond that, with every successive year, obviously your cells are going to become a little more depleted, not quite as useful, not quite as able to regenerate or repair. But we helped a gentleman in his early 90s, and he did fantastic. Now, that's not always going to be the case. We know that, and we have to disclose that as we go into that type of conversation, that there's a good chance it may not work, just based on age.
So let's talk a little bit about cost. And you mentioned earlier that you had to go through a lot of training. There's a lot of equipment involved to be
Right.
able to do this on a timely basis, totally safe. What would it cost for me, for instance, to have my right knee, which is not bone on bone, get back to the point where it's not painful, or
Okay.
at least much more,
Right.
can do a lot more things?
And there's a lot of decisions to be made there, because number one, we have to look at the age of the patient. So, and what kind of conditions are we talking about? So there's some variance there. But if all you did was have a bad knee that needed a little help, needed some regeneration, some repair, nothing else going on, you're fairly young, it would be a one-time procedure, and it would be $9,800. That's the price.
So compare and contrast that to a knee replacement, which would be $50,000 to $80,000.
Correct.
If I'm not mistaken, can you do any stem cells for math? Because I'm going to try some math right on TV here.
All right.
I think 9,800 is less than 80,000.
Last time I checked.
Okay, just
Yeah.
I'm on top of that. So it's there's no difference. And you miss out on the fun of being in the hospital and going to physical therapy every day for 8 weeks.
Right.
So from a time and monetary standpoint, there's no comparison.
It really makes all the sense in the world.